International Symposium on HIV Medicine. Once again, I'm here with you. I'm Pachari Raksawong, and what we're doing here, we've got real-time live streaming interview sessions. We're going to be meeting with the experts and finding out the latest regarding HIV research, treatment, and a possible cure. Now, co-hosting this morning's session, we have Dr. Jintanat Ananworanich. She's the Associate Director for Therapeutics Research, U.S. Military HIV Research Program. She's also with Research at the Thai Red Cross AIDS Research Program. Good morning, Sawadee ka.
Good morning.
Thank you very much for being here with us this morning, joining us. Now, you just came out from the symposium yourself.
That's right.
You had a very interesting topic to present to the delegates and participants. Tell us a little bit about that.
So we're very interested in identifying people early in infection. We believe that if you can diagnose people early, treat them early, we can reduce the amount of infection in their body, help their immune system to better control the virus, and that may be helpful in the long run.
And help them live a more comfortable life,
healthier life.
Yes. Right. Now, you were also talking about acute HIV infection in children as well. That was very interesting. Yesterday we had topics related to children, but for now we're going to bring on Nicolas Chomont. I hope I pronounced his name correctly because my French is zilch. So we're going to have him come in and introduce. So ladies and gentlemen, let's welcome Nicolas Chomont. Sawadee ka. Bonjour, I should say, right?
Yeah, that's perfect. Your accent is actually quite good.
Thank you very much. Now, tell us, you're with Center. I can't do this.
So I'm come from University of Montreal, but I'm affiliated to a research center there, which is called the CHU. That's
See, I can't do that one.
That's okay.
But yes, you're going to be telling us more about HIV reservoirs and strategies towards an HIV cure. You were also at the symposium and delivering a presentation there. What were some key points?
So I think the key point is that we do not have a cure yet. We do not even have good strategies to really get a cure right now, but we have, I would say, correlates or ideas of what we should do to get closer to a cure. I think Jintanat already mentioned that, but many of the studies that Jintanat is actually conducting right now show very clearly that if you treat patients very early on, so in the first few weeks after infection, this could have a dramatic impact on the amount of HIV that persists in the body of these participants. So I think, again, we have clues, even though we do not have a cure yet.
Right. And how much longer do you think it will take? And what is making the process challenging, so challenging?
So to answer your first question, I won't answer your first question because it's just impossible to give a timeline.
No one you ask will say how many years, because we really don't know. No one you ask will.
Well,
we just don't know.
Okay.
You know, there have been so many promises that have been made in the past and so many disappointments that we have to be very careful with any timeline and be very cautious with that. And your second question was, why is it so difficult?
Yes.
This is a complicated question because there are actually many reasons why it is difficult. I think that one of the most important reasons to me is the fact that HIV hides very efficiently in some tissues, in the brain, in the gut, in lymph nodes, in different parts of the body, and that it's really difficult to get it out from there. So I think that's the main reason why we don't have a cure.
Right. Yes, as you both mentioned, I mean, I was doing some research myself. I'm not an expert in this field, so I've been trying to do as much homework as I can regarding the latest. But we're here at the 19th Bangkok International Symposium on HIV Medicine. Now, at the 19th International AIDS Conference, AIDS 2012 in Washington, D.C., they were very excited. They were like, oh, coming out, oh, this and that, this is the latest, etc. And now it's 2017 and we're not there yet with a cure. And you mentioned the obstacles. What more has to be done?
So first, I'd like to say that we should not give up because even though we've been working on these cure questions for many, many years, I think we're making progress. You know, there's still lots of basic questions that we have to answer before even thinking of a successful cure. We still do not fully understand how HIV persists in people during antiretroviral therapy. We still do not fully understand what we would need to make sure to eradicate the virus and to be able to control it. So we are making progress. It's slow, and there is nothing, you know, spectacular until now. But we have to pursue this effort if we really want to find a cure.
Okay. Can you further highlight the strategies towards an HIV cure? This is the topic that
Yes.
you were given?
Yes, absolutely. So there are several strategies that are under development right now. I mean, the first one that, again, Jintanat mentioned during our talk is to treat people very early on. And this is actually the only strategy that has worked in the past, because we know that a few people that have been starting antiretroviral therapy very early on were able to control the virus naturally after interrupting the ART. So there's really something there. Not every people can start antiretroviral therapy early on, so we have to find alternative strategies. We are working in collaboration with many people who are here at this conference on immunological strategies to really boost the immune system and at the same time try to get rid of the reservoir in the tissues.
Okay.
And these are not the only strategies. I mean, there are tons, so I won't have time to explain all of them.
Right.
And I think Thailand is really at the forefront of this. I mean, we have one of the largest cohorts of early treated people in the world. And we're doing many studies looking at vaccines, looking at giving antibody, looking at giving drugs that maybe we can help to control the virus better.
Yeah, Jintanat is being very modest, but she's actually conducting one. I think everybody would acknowledge that the study that is conducted in Thailand is the largest one and probably the best controlled one, and the one from which we're going to learn a lot.
Right.
In this study.
So exciting, and we'll wait to hear successful results from that.
I would say whatever the results show, we're going to learn a lot.
Yes, I'm sure, and then we'll work on from the results
To improve further
to
and
continue
further.
to
Yes.
work towards that cure we have been waiting for whenever it happens. But I know that you're all going to work extremely hard to help each other, because I know we talked a lot about collaboration
Yes.
in terms of educating people and understanding it, so we reduce the stigmatization as well on people who are affected. Now that is also important as well. Any final words to the audience and viewers joining us live around the world?
Well, I just want again to thank Jintanat and all the organizers of this conference. This has been a great adventure. I'm very happy to be here, to meet with the people we are working on a daily basis. We are very fortunate to work with them, to get samples from participants here in Bangkok, and I hope we're going to learn a lot from those.
Thank you. Thank you so very much for traveling all the way around the world to be here in Bangkok
course,
from
my
Canada.
pleasure.
Khop kun ka. Thank you. Thank you. All right, so we have just spoken to Nicolas Chomont there on HIV reservoirs and strategies towards an HIV cure. Now we're going to move on to talk about strategies in curing people who start ART late.
Right.
This is it's also very important, because usually people are encouraged, right, to start as soon as possible, but of course not everybody can start
I would say
right
most
away.
people in the world living with HIV now start treatment late.
Late.
Yes.
All right, so this is very crucial, and we're going to bring on our next guest.
Yes.
Professor Sharon Lewin, Director of Doherty Institute for Infection and Immunity of Melbourne, Australia. Let's welcome her on the stage. And you are going to throw her the questions.
Okay.
Hi.
Sharon has worked in Thailand for many, many years and has been a great supporter of our studies. So maybe we talked with Nicolas just now, and I mentioned a little bit about early treatment. What might be the key differences between people who start treatment early versus late, and how would that help us in thinking about the cure?
Okay, so first of all, I'll start with saying across the world, even in a country like Australia, most people start treatment late, which means after being infected, actually most people are diagnosed late. They've been infected for years already with HIV. They start treatment. They do very well on treatment. Life expectancies return to normal. Treatment works extremely well, even if it started late. But we know by that time there's damage to the immune system, and there's a lot of cells that go into hiding, or what we call the reservoir. And they're the two key barriers to a cure: having cells that are infected that are in hiding, and having a weakened or dysfunctional immune system. And those two challenges are much worse when you start treatment late.
So what might be some things that, if a person who's now living with HIV started treatment late, like what can that person do to help them be healthier, or maybe have a better chance towards a future cure when that becomes available?
Yeah, so at the moment we don't, of course, have a cure for HIV. All the work's targeted at achieving a remission, allowing people to safely stop drugs and the virus not bouncing back. And at the moment, if you start treatment early or if you start treatment late, the virus bounces back. So people that start treatment late, I don't think are disqualified, or we have no data to say that they will never achieve remission. The most important thing for people with HIV on treatment is to stay on treatment and continue it without missing tablets. And treatment is lifelong at the moment. I think there are some interventions that theoretically might work better in people who start treatment late. One area that I've been interested in for a long time is flushing out the virus from its hiding place. And there's emerging data now suggesting that maybe it might be easier to flush out that virus with people that have a bigger reservoir is one possibility. Targeting inflammation may also have a greater effect on people who start treatment late. But actually, to date, most people that start late are often excluded from the studies, interestingly. So it's something we need to start paying a lot more attention to.
Right. And
is it a challenge, if I may just jump in here, is it a challenge to find people to come in and participate in the research? Because R&D is so extremely important. You talked about a method of flushing the virus out. So you actually need people to come in, right, for the experiments. Is that a challenge for you?
Actually, it's interesting. I think Jintanat can talk a lot about her great success here in treating people very early and enrolling them in clinical trials. My experience in Melbourne has been clinical trials in people who have been infected for many, many years. And we have a huge interest. In fact, we've done surveys of people living with HIV, asking whether they would or wouldn't like to participate. Around 50 to 60% of our patients in Melbourne who have been on treatment for a very long time are interested. What level of involvement they want, of course, varies. Their appetite for risk or understanding the science. But there's a real high interest for people to contribute to science. That's been a history of the HIV epidemic from the beginning, that an engaged, informed community has made a massive difference to the advancement of science. That happened at the very beginning with developing antivirals, happened with prevention strategies, and that same partnership model is happening in cure strategies and absolutely critical for advances in science.
Very, very true. And I think the support system there for the people, that's extremely important. And yeah, as you mentioned, educating people around them to understand people infected with the virus. You had another question?
No, I just wanted to add to that too, that in HIV, the community is very much part of the research we do. They come in from the very beginning, give input. And so it's like a teamwork, because we need them to do this successfully.
And it's actually, science is really complex. We talk about waking up the virus going in hiding. You're doing well on treatment, but there's no cure. There can be potentially mixed messages there. People think because they're healthy on drugs, they're cured. But when we talk about cure, it's whether one day people with HIV can safely stop their antivirals, which at the moment they can't do.
All right. Okay. Now, just to wrap things up here, once again, in a nutshell, tell us some of the main strategies in curing people who start ART late. Can you just highlight them for us?
Yeah, the two main strategies are to reduce the amount of virus that goes into hiding and to boost the immune system and return it to a normal function. And one strategy to reduce virus that goes into hiding is to try and wake it up and flush it out. And the other way to try and boost the immunity is by giving vaccines. We're doing that in different sorts of studies. We're actually using these new cancer drugs that wake up the immune system to work against cancer. There's a possibility that these drugs may also work in waking up the immune system to address HIV. And in fact, those drugs will first be tested in people who have started antiretroviral treatment late, because they often need those drugs for treatment of cancers. So the strategies are the same, but some of the risks and questions and issues that we need to consider when we use those strategies in people who start late are a little different.
Right. Okay. Any final questions, comments right here? Okay, then we're going to wrap up your session here. Thank you so very much, Professor Sharon Lewin, for being here with us. ขอบคุณค่ะ ขอบคุณค่ะ
Thank you.
Thank you. Thank you. Now, for this first session, for the second day of this 19th Bangkok International Symposium on HIV medicine, we have one more guest joining us. And we're going to invite Ms. Gail Henderson now from the Department of Social Medicine at UNC School of Medicine, United States of America. Hello, good morning to you. Now, we were touching on a little bit HIV cure, which is, we're not going to talk about a time frame because that will come when it comes, yes. But we're going to work hard and continue to persevere until that big success story arrives and we're all going to be happy about it. But to get there, research is extremely important. And of course, in terms of research, you need people to come, volunteer, participate. Your topic, why would someone join or not join HIV cure research? Can you tell us more about that?
Right, so we have a study that has been facilitated by Dr. Jintanat's large-scale early identification of HIV-positive individuals, and it's a decision-making study. Mm-hmm. And we are looking at people who decide to join cure trials, so that they don't call them cure, they call them remission trials, and people who decide not to. So that's just, and we follow people over time.
So Dr. Henderson has had a lot of experience working on why people consent to different trials and genetic studies and all sorts of things, and so we're very happy that she's doing this in our studies. Mm-hmm. And we have multiple studies that we're asking participants to join to do different things.
Yes.
And so she's doing this social science across all studies.
Okay. Is it difficult, though, to find suitable candidates?
Well, we found that people to agree to be interviewed, no. It's not, I think that the people who are part of Dr. Jintanat's cohort mm-hmm. are very pleased to be already in research and are very happy to talk to us about their responses to cure trials.
Okay. And what we're asking people to do is a lot more than what they would normally need for healthcare. Mm-hmm. They have to come in every 3 days, they have to get blood draw, they have to get injection with experimental agents sometimes. And those things, we really want to know that they understand it well, and through this research, mm-hmm. that's what you're looking
right.
at.
And these are all what they call early phase trials. That's the first time in humans, perhaps, or just really looking at safety. And those are studies that in other disease areas, people, bioethicists, institutional review board, regulators really worry that do people understand that there's very little chance for personal benefit? Mm-hmm. And so that's something that, in this case, these are also early phase trials, but they're different because these individuals are pretty healthy and they are going to be asked to go off their treatment.
Yes, I was going to touch on this because I have been reading that to go on these trials, sometimes you have to be taken off ART, but they're actually enjoying a more comfortable life taking treatment, and then all of a sudden, come in, we want to, if you don't mind, participate in our research, but we have to take you off ART, and then what happens there in that situation?
Right, and that's a perfect question, and that's what people are worried about. And what we found is if somebody doesn't feel comfortable with that, they don't join the trial. But there's a benefit to going off their drugs that I had not really anticipated. They really like the idea of stopping ART under a very controlled, monitored situation where they really trust that the minute there's a side effect or an increase in their viral load, that the staff and the doctors and nurses will put them right back on treatment. So they feel it's a very protected environment to undergo what you correctly identified as a pretty big risk.
Right, and that's fine that they're taken off and there's a disruption.
We have them come in every 3 days for blood tests, so we're monitoring them very carefully. And for many, that's even more burdensome, the fact that they have to come in so much.
That's right. And what happens sometimes halfway, they're like, okay, I want to stop now. Do you have volunteers?
Then we have not had that, but if they want to do that, then they can stop the study.
Possible.
Yes.
Okay.
Yes, it's truly voluntary.
All right, and monitoring would mean that they would have to go into the facility themselves, right? And you don't have staff or anyone visiting them and checking up on them?
No, not usually, and that's also for confidentiality. People don't necessarily want that. But I mean, we're in very close contact.
Okay. So that's from the patient side. And now let's look at the other perspective. The staff, the doctors, the team, any challenges there?
Well, we're only interviewing participants or decliners. But what we're finding, we had a meeting with the search team. We're finding they have a lot of interest in knowing what we can tell them. And we just started our work. We have another 3 years on our study. They're really interested in learning what we want to learn. How much do people really understand? And our group is not really associated with the search team. I mean, we are very privileged to work with patients that are in search, but we're completely separate. So I think in that regard, and we have a wonderful interviewer who I think makes them very comfortable, and we promise that no one will know what they're telling us. But the researchers have been very interested to hear what do they really think. And we provide that in an aggregate form, not individually
And
identified.
I think at the end what we want is really recommendations of how we can do better in HIV cure research.
I see. Can you tell us about how many people are taking part in this research at the moment? Tell us more about...
Well, the acute HIV cohort now has about 450 people.
Okay.
The different people in the different studies now are probably over 50 at this point who've gone through taking additional drugs or treatment interruption. So we will be presenting those results in the next year or two.
That's great. That's great to hear. So do we have any final words for the audience here?
I think that what's happening in Thailand and with this search cohort is just extraordinary. And I personally feel extremely privileged to be able to do a study, follow people in real time, and really understand what they're thinking about. Because this is the first time that a lot of the sciences happen, and it's the first time for the social science as well.
Now, what would help further facilitate the process and everything, speed it up towards a cure?
I look at this as Nicolas had a slide on stairs.
Yes.
We're going up these stairs towards a cure and a remission. Yes.
All right. So we're not going to be talking about an exact time,
No.
but we're moving up those stairs.
Right.
All right. Now, I believe we do have 5 more minutes, so we can continue to talk on this topic. If you have any final words, Dr. Jintanat.
I just think that we all have to help people know about HIV diagnosis, know about HIV treatment. We all have to try to help to reduce stigma in Thai society, because that really kills. Stigma is the reason why people still die of HIV. So if we're able to diagnose people early, treat them early, even if they don't ever come into cure trials, I mean, they could remain with a healthier, happier life and very little chance or no chance of transmitting HIV to other people.
Right, okay. That's going to wrap up this session then. Thank you so very much.
Thank you very much.
Ms. Henderson from the Department of Social Medicine, UNC School of Medicine. Once again, thank you so very much for being here, being a part of our 19th Bangkok International Symposium on HIV medicine. And we also have to thank you very much as well, Dr. Jintanat Ananworanich, Associate Director for Therapeutics Research, US Military HIV Research Program, also heading search there at the Thai Red Cross AIDS Research Program. Thank you. Now that's going to wrap up today's very first real-time live streaming interview. We do have one more coming up, and we will be discussing with the experts topics such as neurocognitive function and frailty in people aging. We're also going to be looking at cognitive mental health evaluation, prep programs here in Thailand, and overview of data revolution as well. So join us. We're going to begin the next session at 12 on the dot. See you then. Sawadee ka.